Hi, it's Melissa, RDH and Senior Burst Ambassador. I'm bringing you another Burst TV video, and this week's topic is, what is my favorite dental procedure? What do you think that is? This is called a full mouth debridement. A full mouth debridement is a cleaning that is designed to remove an excessive amount of tartar buildup that had developed around the tooth and gum, and it's really for patients that a regular cleaning may not be able to take care of. Often we see it in patients that maybe hadn't had a cleaning in maybe a stretch of 10 years or more. Now, an important treatment that we do at the initial visit is called a periodontal screening. And what that is we take special measurements around each tooth, measuring the pocket depths using a periodontal probe. This is used to identify periodontal disease. But because of the amount of tartar buildup or calculus that is surrounding the tooth and right at the gum line, our dental instrument just can't get into there. This is why in this particular case, a full mouth debridement is recommended. And of course, x-rays are very important to assess radiographically any underlying issues with their teeth, or of course, check for any bone loss. What we use is specialized instruments called ultrasonics, and the vibration and water helps break up the tartar pieces. We carefully clean all around the gum line, slowly removing each piece. And then once we're done using the ultrasonic, we will go back and use more of our hand scalers just to slowly remove any of the excess that we see. Local anesthetic can be used if needed, and there's also a variety of topical anesthetics that's available. It just depends on your comfort level. That's important. We want to make sure you're feeling comfortable. But of course, this is what I love about the full mouth debridement. The before and after is, look at this. Just so satisfying. This is such an important first step in getting the patient into improving their oral health. We are removing this tartar buildup, all done within a matter of minutes, up to an hour maybe tops. All of that bacteria is gone. And of course, after the debridement, the dentist can more accurately diagnose for any decay or any other issues going on. And of course, we're able to do the periodontal assessment once we take our gum measurements, check for any gum recession, mobility, also check for bleeding. We collect all of the data that we find, and this will determine the patient's perio status and determine what kind of cleaning they're going to end up being. Now, normally if you have no bone loss on the x-rays, a lot of times we'll just follow up with a regular cleaning, usually between 2 to 4 weeks follow-up. This allows some of the gum tissue to start healing already, and we can reassess, and at that time we'll be able to also polish their teeth. But if there is some bone loss, periodontal issues, then the dental hygienist will also discuss possible treatment options. Usually we will do scaling and root planing, which is a topic that I discussed in an earlier video. Now, what to expect after the full mouth debridement is your gums will have some tenderness, there will be some bleeding, some soreness. Simple ibuprofen is usually recommended. We even recommend a post-rinse, a prescription rinse sometimes to use for the next 2 weeks. This will help the healing process as well. So some of the common questions I get asked as a dental hygienist is, why do I build up so much tartar? What causes it? And here are some things that can cause more increase in tartar production. A diet high in sugar, carbohydrates, not flossing and brushing properly or routinely. Some people that have more minerals in their saliva, which causes a more rapid accumulation of tartar buildup. Smoking also does change the oral environment along with aging. Hormonal changes, such as pregnancies. And of course, can't forget braces or other appliances. This just leads to more plaque accumulation because they're harder to clean. There's more spaces for plaque to hide. And so it leads to more tartar buildup too. So a lot of times when I have patients in ortho, we will see them more often, every 3 months versus every 6. And remember, an improved gum health will lead to an improved overall health. Studies do show that periodontal disease has been linked to diabetes, heart issues, certain cancers, Alzheimer's. And then again, be sure to floss every day, make sure you're brushing well. Studies do show that electric toothbrushes work so much better than a manual toothbrush. So do make a switch and use the electric toothbrush. Do be sure to schedule for regular dental appointments. Sometimes you'll need to come in more often, every 3 months, but that's really based on your gum health, and your hygienist will follow up every visit. Well, I hope my video was helpful and informative. Give me a thumbs up if you liked it. Don't forget to subscribe to Burst TV so you don't miss out on any weekly videos that we post. It's usually every Thursday. If you have any questions, please leave them in the comments below. We always love to answer them for you. And as always, you be safe.